Every man needs a woman when his life is in a mess because just like in a game of the chess, the queen protects the king. So the woman who is really devoted to you can do a lot for you. Now, coming back to the normal microbial flora, bacteria found on the skin, Staphylococcus epidermidis make up about 90% of the resistant aerobic flora. Staphylococcus aureus, seen in 10 to 40% of the normal adults, mostly nose and perineum are the places where these are found. Seen 67% on the vulvar skin. Occurrence varies with age, greater in the newborn, less in the adults. Micrococci, less common, Micrococcus luteus counts for about 20 to 80% of the micrococci. Streptococci, beta hemolytic streptococci are rare. Reason presence of the lipids on the skins are lethal to the Streptococcus B hemolytic. Alpha hemolytic streptococci exist in mouth and that can spread to the skin. So here one can see the Staphylococcus epidermidis, micrococci, streptococci, diphtheroid bacteria, and the gram-negative bacilli, which make the normal microbial flora. Diphtheroids colony form four groups: lipophilic, common in the axilla, or non-lipophilic diphtheroids on the glabrous skin, which is without hairs; anaerobic diphtheroids, common in areas rich in the sebaceous glands; and named Corynebacteria acnes, now classified as Propionibacterium acnes and as Propyne granulosum. Diphtheroid producing porphyrins, coral red fluorescence when viewed under ultraviolet light that possess some keratinolytic enzymes and associated with the trichomycosis axillaris, infection of the axillary hair. Then gram-negative bacilli make small proportion of the skin flora. Their scarcity on the skin is strange, but seen in the moist intertriginous areas like toe webs and axilla and not on the dry skin. Due to the desiccation, gram-negative bacteria cannot multiply on the intact skin. That's why they are not very much on the skin. Enterobacter, Klebsiella, Escherichia coli, Proteus species, Acinetobacter species can occur on the moist intertriginous area. Nail microbial flora. The microbial flora of the normal nail is similar to that of the skin. Dust particles and other irrelevant material get trapped under the nail depending upon the nail contacts and the environment in which these are found. These dust particles may carry fungi and the bacilli. Aspergillus, Penicillium, Cladosporium, and Mucor are the major fungi found under the nails. And here one can see the different bacteria and the fungi that can be seen in the dirty nails. Oropharynx and upper respiratory tract saliva contains antimicrobial enzymes. The tooth consists of a mineral matrix, enamel surrounding living tissue, dentin, and the pulp. Bacteria colonize tooth surfaces. In oral cavity, Streptococcus anaerobes live in gingival cleavage. These make thick bacterial layer, dental plaque. Streptococcus sobrinus and Streptococcus mutant produce high concentration of the acid. These result in the decalcification of the tooth enamel and causes the dental caries. Here one can see the different parts of the tooth and the root, the pulp, where the bacteria can reside and can damage the dentin and the enamel. Periodontal disease, abscess, foul smelling, discharge, and endocarditis are due to the normal microbial flora. A breach in the microbial surfaces and the mucosal surfaces cause infection of the host by the normal microbial flora, because from here the bacteria can get entry. Anaerobes in the oral flora cause infection of the brain, face and lungs as abscess formation. The pharynx and the trachea contain alpha and beta hemolytic streptococci, also anaerobes and staphylococci. Pathogenic bacteria like Haemophilus, Mycoplasmas, and pneumococci, also the Neisseria, Bordetella, Corynebacterium, and Streptococcus species. Here one can see the upper respiratory tract that contain the sinuses, the nasopharynx, the pharynx, oral cavity, and the larynx. Then the lower respiratory tract infection, that is trachea, bronchi, and the lungs. Oropharynx, if the bacteria introduced into the blood after tooth extraction or tonsillectomy, they settle on the prosthetic heart valves and the cause endocarditis. Aspiration of the saliva from the normal microbial flora results in the necrotizing pneumonia, lung abscess, and empyema. Lower respiratory tract is usually sterile and the bacteria do not reach it. If bacteria do reach, they are killed by the alveolar macrophages not present in the pharynx. Sterile sites are the sinuses, middle ear, brain, lower respiratory tract, trachea, bronchiole, and lung. Here one can see these bacteria, Streptococcus mutans, causing tooth decay, caries, and the plagues, Haemophilus, Neisseria, and Streptococcus sobrinus. These are all become pathogenic when the conditions are favorable for them. The genitalia, it includes external genitalia, urethra, and vagina. Transient organisms like Candida species frequently cause vaginitis. Type of the bacterial flora found in the vagina depends upon the age, pH, and the hormonal level of the host. Lactobacillus species predominate in the female infants because their vaginal pH is 5 during first 5 months of life. Glycogen secretion sees now diphtheroid, Staph epidermidis, Streptococcus, and E. coli seen at higher pH, which is 7 now. So at puberty, glycogen secretion resumes, pH drops, and women have an adult flora. So here one can see the anterior urethra, vagina, sterile sites are the bladder, cervix, and the uterus, but the other places do have the inhabitation of the bacteria. Male anterior urethra has same flora as the skin, Staph epidermidis, enteric plus Enterococcus. Lactobacillus acidophilus ferments glycogen producing lactic acid to maintain acidic pH. In female, after menopause, pH again rises as less glycogen is secreted. Flora now returns to that in pre-puberty stage. Yeast, Candida, and Torulopsis are found in vagina, causing vaginitis. The distal urethra contains mixed flora organism present in the urine unless a clean catch midstream specimen is obtained. Sterile sites are bladder, cervix, and uterus. So one can see the Candida, E. coli, Lactobacillus, and Neisseria gonorrhoeae. These are the bacteria which can be seen there. Can you imagine the skill of this woman? It's really unbelievable. She is just throwing the arrow by the leg and very accurately. It's really a masterpiece. Now the gastrointestinal tract includes esophagus, stomach, small intestine, large intestine. Stomach is a hostile environment for the bacteria because it have got the acidity which kill bacteria swallowed with food. Acidity lowers the bacterial count, highest after meals and lowest after digestion. Helicobacter pylori can survive in the stomach, causing gastritis and peptic ulcer disease. Aspirates of the duodenal or the jejunal fluid contains microflora, streptococci, lactobacilli, and the bacteroids. Bacterial presence here indicate digestive system problems like achlorhydria or malabsorption syndrome, which favors the growth of the bacteria. So, if you do see deeply, one can see the different bacteria here, and the normal flora is Bifidobacterium, Enterococcus faecalis, Lactobacillus, and Escherichia coli, which are residing there as the normal flora. Rapid peristalsis and the presence of the bile decrease number of the microbes in the upper GIT. In ileum, microbes increase in number maximum at ileocecal junction. It is a mixed flora, streptococci, lactobacilli, bacteroids, and bifidobacteria. There is a dense flora in the large intestine, the colon. There are about 400 species. 95 to 99% are anaerobic species. Bacteria, bifidobacterium, Peptostreptococcus, and Clostridium are the main bacteria. Here one can see, starting from the esophagus, lactobacillus, then as we are coming down in the intestine, Enterococcus, lactobacilli, and as we are going into the colon, one can see the Enterobacter and Enterococcus and Bifidobacterium, Eubacterium, and many anaerobic bacteria. So these are the just bacteria which are about many types, 400 types in case of colon. Many anaerobic members cause disease like intra-abdominal abscess and peritonitis, bile perforation by the appendix, cancer, infarction, surgery, or gunshot wounds contaminate the peritoneal cavity with the normal flora. Treatment with antibiotics allow the anaerobic species to cause disease. The Clostridium difficile under antimicrobial therapy produce pseudomembranous colitis and conversion of the bile acids to carcinogen and produce ammonia, which is very much commonly seen in hepatic coma. And here one can see the bacteroid, the Eubacterium, Clostridium, and Bifidobacterium. Now, the normal flora of eyes, lids, and the conjunctiva or conjunctival flora, variety of the bacteria, low numbers present, high moisture, blinking mechanically removes the bacteria which temporarily reside there. Lacrimal secretion include lysozyme, Staphylococcus epidermidis, and Propionibacterium acnes dominate. Staphylococcus aureus Haemophilus species and Neisseria species occasionally found, few or no organism. 50% of the culture samples are negative. So here one can see the few bacteria which are normal flora of the conjunctiva, and these are not very much more in number, these are very much less in number. Here one can see really beautiful tree and with a bird just making the nest and the beautiful branches of the tree, which is just the praise of the nature to have that much possible. A human being can't make even a single leaf of a plant. Now, specimen containing commensals, these are the skin and the ulcer specimen, eye discharge, throat and mouth specimen, nasopharyngeal and nasal specimen, sputum, urogenital specimen, feces and the rectal swabs, and urine, small numbers of the commensals. These are all found in these specimens. And here one can see the ear, the broken skin, the anus, eyes, nose, mouth, female vaginal urethra, all these are having the specimen. Now, specimen not containing commensals, or you can say the sterile, these are the pus, wound, abscess, burn, sinuses, cerebrospinal fluid, blood, serous fluid like synovial, pericardial, ascitic, and hydrocele, amniotic fluid. Note, take special care not to introduce contaminants into these specimens. Normally, these do not have any kind of bacteria, but when we enter in these places, one can just contaminate that places with that. So, in the last, the take-home message is, in laboratory investigation of the microbial infection, be aware of these sites that are normally colonized by the microbes. These can confuse to interpret cultures, as these bacteria have similar shape and appearance, so you can't differentiate between the normal microbial flora and the pathogenic bacteria. And this is all to prevent growth of the unwanted commensals. Use a selective culture medium which will inhibit the growth of the commensal and it will allow the growth of the pathogen only, while supporting growth of the pathogen suspected causing the infection, and you can come to know what kind of the bacteria have caused the infection. So that is the end of the lecture, and I hope and request to subscribe the lecture if you like it, and if you have any kind of question or query, please do not hesitate to ask me on my phone number or WhatsApp, and feel free to talk to me. And thank you very much for watching.